Dynaspeak Online, Unit 10, Level 3, Listening, Healthcare 2.
Good morning. I'm Ryan Alexander. Welcome to My Point of View, the radio show where I give my opinion on various topics of interest. And you, the listeners, send me emails to express your own points of view. This morning, I'm going to be talking about healthcare in New Zealand and America. I was thinking about this topic because right now, my dad is in hospital in the United States, and I have a friend in hospital here in New Zealand. And I was thinking about the difference between the two systems. Over the past 5 years, I've heard a lot of stories on the news from the US about the positives and the negatives of public health care. I'm still surprised that I can walk into a hospital here in New Zealand, sign a form, and get public health care for free. It's a big relief when you first experience this. You know you're going to get health care, you know it's going to be free, and you know that when you get out of hospital, you're not going to have to deal with hospital bills or insurance companies. But there are other things that you should know about public health care in New Zealand. First of all, if you go to your family doctor, you have to pay, and it usually comes to about $50. But if there are any tests or you need to go to hospital, then those things are free. Now, I've heard a lot about waiting lists, but they're not quite as bad as they sound. If it's an emergency and a patient needs immediate care, the hospital staff will see him straight away. But if he needs surgery, he may need to go on a waiting list. However, the government does have guidelines in place to try to keep those waiting lists down to as short a time as possible. Alternatively, a patient can get private healthcare insurance and go to a private doctor. The benefit of the public system is that it's much cheaper than private treatment. Another concern I've had is that taxes are going to be raised to pay for the health service. That's not the case. The taxes that I pay here in New Zealand are actually similar to what I paid in the United States. So not only do I get free healthcare, but I also have access to a variety of other social services. I feel that the New Zealand Health Service is giving me quality healthcare and peace of mind for my tax dollar. If we compare healthcare in New Zealand and the United States, is the level of care similar? No, there are many differences. I would say that the quality is similar. New Zealand has cutting-edge technology and highly qualified doctors, as does the United States. The only problem is that most specialists are located in Auckland, which is the biggest city, with about 1.4 million people. My friend lives in Wellington, but she had to go to Auckland for a consultation before she could have surgery. In Wellington, there are only 180,000 people, so in order to get specialist services, people often have to travel to Auckland. The biggest difference between the healthcare systems in the United States and New Zealand is the approach. New Zealand has public healthcare, while in America, people have to pay for doctors, prescriptions, hospital care, and treatment. In New Zealand, there is ACC, which is the Accident Compensation Corporation, which is a form of healthcare insurance. For example, if a person has an accident at work, this insurance scheme pays for the hospital bills. Tax is deducted from people's wages to pay for this. We have no such scheme in the United States. People have to sue their employer or use their own healthcare insurance provider. ACC takes care of the hospital bills, and when the patient goes home, there is also an occupational therapy service free of charge to help them get back to work. ACC pays for your bills and rent while you are convalescing. It pays up to 80% of what your income would be if you were working. Prescriptions cost much less than they are here in America. I got a prescription for my daughter recently, and it was a fraction of what it would have been in the US. Tests and x-rays are also subsidized by the government and are much cheaper than they are in the USA. So, all in all, I would say that healthcare in New Zealand is designed to help the population and care for the average householder in a way that is caring and affordable. It compares very well with America, where people struggle to pay large hospital bills, and where doctors have been known to refuse to treat a patient who does not have private health insurance. So that's it for today. If you want to give your views on healthcare in New Zealand or the United States, send an email to me, Ryan Alexander, at ryanalexander@radio5.ac.nz. I'll be back next week, same time, same place, with my point of view.